Thank you, ladies and gentlemen, for joining us across the great Louisiana plain, where we are having so much fun advancing the cause of constitutional freedom in Louisiana, and slowly but surely, day by day, and on some days quite rapidly, draining the vast Louisiana swamp. My name is Chris.
And I'm Danielle, and this is the State of Freedom, brought to you by freedom-loving Louisiana First Patriots. Hello, State of Freedom warriors. Thank you so much for joining us today, for inviting us to be part of your day. We are so thankful for you. As I always say, and I mean it every time, you are the absolutely best listening family anyone could possibly hope for. And we are only here because of your encouragement, your prayers, your friendship, your financial support. If you're looking for a way to support us, to advertise with us, or to send us feedback, please visit our website at freedomstate.us. We'd also really appreciate it if you'd help us get the word out and spread the reach of the State of Freedom. Like the show on whatever platform you listen to us, subscribe to it, share it. You can share short clips from YouTube and Rumble instead of sharing the whole episode, and links to those are always in the show notes and over on freedomstate.us. Today, we have a very special guest joining us. Dr. Kat Lindley is a doctor, a warrior, a woman of faith, and she has been relentless in her pursuit of truth and bringing the truth to public awareness. Before we introduce you to Dr. Kat, let me read the scripture of the day. It's Genesis chapter 1, verses 26 to 31. And it says, "Then God said, 'Let us make man and a woman in our image to be like us. Let them reign over the fish of the sea, the birds of the air, the livestock, over the creatures that creep along the ground, and over the wild animals.' So God created man and woman and shaped them in his image inside them. In his own beautiful image, he created his masterpiece. Yes, male and female, he created them, and God blessed them in his love, saying, 'Reproduce and be fruitful, populate the earth and subdue it. Reign over the fish of the sea, the birds of the air, and every creature that lives on earth.' And God said, 'I give you every seed-bearing plant growing throughout the earth, vegetables, and every fruit-bearing tree with its seed within itself. They will be your food. They will also be food for every animal and bird and every creature that moves on the ground, every creature with the breath of life.' And so it happened. God surveyed all he had made and said, 'I love it,' for it pleased him greatly. Evening gave way to morning. That was day 6. And I love reading this out of the Passion Translation Bible. Most of the scripture that I bring to you is from the Passion Translation because I think it just does a beautiful job of conveying the heart of God. We can see right here in Genesis chapter 1 from the beginning, the Lord made humanity in his image, and his first command to us was to be fruitful and to multiply, to populate the earth and subdue it. And the footnote in my Bible explains that the word subdue means to take dominion or to control. It implies the harnessing of natural resources in an appropriate fashion, caring for the earth, cultivating, harvesting its fields, mining its resources, and releasing its potential to benefit God's highest creation, humankind. So let's not forget this, and let's not fall into the globalist trap. I know none of our listeners will, that humanity's very existence is destroying the earth. We could obviously be taking better care of the earth. There's no question about that in my mind. And I believe we absolutely should be taking care of it as part of God's original command. But we were absolutely meant to use it for our good and our benefit. It was made for us, not the other way around.
Exactly. And Danielle, it looks as though some of the priorities, if not the fundamental priorities of organizations like the WHO and the UN and the World Economic Forum, their objectives seem to be fundamentally at cross purposes with the command of God that you just read, that we're to be fruitful and multiply, manage the earth responsibly, but ultimately we are supreme over all other created things. And I don't believe that that is the premise of the actions that have been taken over the last 3 or 4 years by these international organizations. I think the premise is just the opposite, as you just alluded to. And to speak to us today about some of these issues is someone as you said, Danielle, who is such a warrior in this fight, a family medicine doctor, Dr. Katarina Lindley. And it is such a joy to have you with us, Doc. How are you today?
I'm doing great, thank you. I just have to actually say something about the scripture. What it struck me, it says, men and women reign over animals and everything, things like that. And you kind of lost me there because the first thing that popped in my head was One Health. The World Health Organization, One Health Agenda. One Health Agenda says that humans are not more important than animals and plants.
Wow.
So it was kind of like, until you read this scripture, I didn't really connect the two.
Yeah.
But it's very interesting to see that they went after that.
A direct affront.
Yeah.
It's really, really interesting, Dr. Lindley. You are you are someone who has not been bashful, not been shy at all about your feelings, your position, which are shared by millions of people who perhaps don't quite have the courage or the intestinal fortitude to express things publicly the way that you do. Which brings me to your background. I know, Danielle and I know that you actually fled communism in the former Yugoslavia. And so you have seen close up and personal what totalitarianism and government tyranny looks like. Would you talk to our listeners? I know a lot of people already know about your background, but some of our listeners may not. So talk to us before we get into the specifics about your background growing up and some of the influences that you have had that have created this awareness on your part about some of these sinister forces arrayed against us.
So, I grew up in Yugoslavia at the time, and I left when I was 18 when the Balkan War started. But for the first 10 years of my life, actually, it wasn't even 10, but Josip Broz Tito was the president of Yugoslavia. And obviously, it was a communist country. As a child, I have some memories of it. One of the ones I always talk about is the fact that you were not allowed to discuss that you go to church because the state, the government is supposed to be a church, and that's kind of what we're seeing now when there is a direct attack on faith with what happened over the weekend with that transgender visibility day. And although like people keep on saying the argument is like, well, we've had this for years now and it's always on the same date, but Easter is on a, it just happened that Easter happened on that date. I think what people don't realize is it was not only an attack on Christian faith, but also White House went out of the way to put the Easter bunny on the proclamation, tying it to all this. And then also on not allowing kids who were submitting art to put any type of religious art on their, on the submissions. It's really, and that's what we're seeing from this administration. We're seeing this idea that the government is the institution we're supposed to worship. Like President Biden one point said, your children are my children. Well, I'm sorry, no, they're my children. So a lot of those things that we're seeing now are things that you kind of see in these totalitarian communistic countries. So, like I said, Tito died in the 80s. And once he died, the country became really kind of confused with what to do. Everyone wanted to be in the power. And essentially, we ended up having the Balkan War in the 90s. And I left one day before the war started and went to live in Italy for several years and eventually made it to the States. And I was able to save the money while I was working and came here on a tourist visa that I was able to exchange for a student visa and then, became a physician, have a family. So I'm really an example of what American dream is. So when this whole thing happened, I eventually kind of started speaking out. Obviously, I'm a doctor, so I spoke about COVID part of it. But I also still speak about the freedom part of it, about this American identity, the fact that we're losing it, the fact that we are, I was just speaking with someone today and I told her this is it. This is like the moment in time where we stay who we are or we totally lose this concept of what the United States stands for.
Yeah. How much damage, Dr. Lindley? We know that you were involved early on, March of 2020, when this COVID pandemic broke out and all of these protocols were imposed upon citizens throughout the world. And you were practicing as a family doctor at that time. What was your initial response to COVID, and at what point did you begin to realize, was it very soon thereafter that you began to realize that this was simply not what it was presented as, not what it purported to be, was not the sinister threat that these powerful international organizations had depicted it as? Describe your response as a doctor to the COVID pandemic itself.
So I always say, I saw this whole thing through two sets of eyes. One was the physician, and one was, someone who came from communist country and who kind of had to work my way through where I am. So one thing that never made sense is we were essentially told to stay home and all this, but then also as physicians, we were told, tell your patients to stay home, take Tylenol and Motrin, right? And then if they feel like they can't breathe, tell them to go to the hospital. Well, my idea of what should have been done is, as a first responders, we are supposed to kind of go in, even if there's like this huge catastrophe happening in the world and everyone around me is dying. My job is to actually go in, you know, suit myself with whatever I can so I don't get sick, but try to figure out how can I help. And even if you don't know what's causing it, you can see symptoms that people are presenting with. So you can treat those symptoms until you figure out the cause, and then you figure out the actual treatment for it. We were not told to do that. We were actually essentially told, stay home, send them to ER, and they'll handle it. So that was one thing that was totally opposite of what should have happened from the medicine standpoint. And then I really recognized this global, it's not global, I would call it like totalitarian type of a thing, because it's kind of hard to decide what is it, communism, fascism, which ism is it. It doesn't matter, right? At the end of the day is this totalitarian approach to what happened. So, at the time I was watching Fox News, and I would, whoever was speaking, there was always that ticker on the bottom. The numbers are going up. Every chart they showed you, the arrow keeps on going up, 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 like to infinity. So, and it's always in red. There's always these flashes, right? And there's this state of fear trying to get you. You can't do this. You can't do that. People are dying in New York, China. They're dropping on the street. So it created this essentially fear everywhere. And then they kind of capitalized on that and said, well, now you have to stay home. You can't do anything. And then they started this bargaining. Well, first of all, you have to isolate. You have to stay 6 feet apart. And then if you wear a mask, you can do this. If you stay 6 feet apart, you can go and stay in line at the groceries, maybe go out early in the morning or whatever. And then they started with the vaccine that was produced very fast, which again, at the time, you could have said, oh, wow, amazing technology. But then you start seeing that there was no safety data behind it, and they kept on pushing it. And then they said, well, if you have the vaccine, you can do this. But people were not necessarily buying it. So it became, you have to have a vaccine to go to work to bring home the money for your family. And I always get stuck on that. People actually, I think, are minimizing that a little bit too much. To me, that was the most important aspect of what happened, the mandate. United States of America is a free country. We're supposed to follow our Constitution. We're supposed to really follow the laws. But if you have a government that's mandating something of someone so that they can actually have those essential rights, like, you're working, you bring home the money, you feed your family, I cannot express how important that aspect was, because we keep on like forgetting about it. But the fact that the government mandated us to take this product so that you can actually essentially live and and bring home money to your family. That's when I knew we lost America. And I still think we have lost it. I don't think the question is, can we bring it back? People still keep on talking like, oh, we're going to lose this. I'm like, no, we lost it. Now the
Yeah.
question is, do we bring it back?
Dr. Lindley, were you prescribing repurposed medication early on in the COVID pandemic for the benefit of your patients?
Yes. So that's the other aspect, like what happened. I was friends with most of the physicians that were speaking out about the treatment, like Dr. McCullough and stuff. What I did is essentially I ignored the aspect of tell the patients to stay home. So if someone was sick, I just did what I was supposed to do and read articles. And the first way we used hydroxychloroquine a little bit more, and then the second way we started using ivermectin. And I'm one of those that didn't really get in trouble because maybe that's my um, history kind of came in. In communism, like you do stuff you don't like
Broadcasted.
talk out, exactly. So I just did my job. I sent the medications to compounding pharmacies because I knew they were gonna not give us trouble. I didn't send it to Walgreens where they can report me to the medical board and things like that. I just kind of did everything under the radar, took care of my patients, and my patients did really well. And that's what's important. That's kind of what I say, that first initiative saying stay home, and it was essentially for doctors because lots of doctors' offices were closed too. There were a lot of things we could have done to help until you figure out exactly what you need at the end. And the fact that they had this war against medications that were actually helping and working again didn't make sense because it was coming from our government, from our agencies who should have celebrated the fact that we have found what works, right? CDC should have been the first one to say, amazing, we have this amazing thing we can actually use so people don't die and go to the hospital. Instead, they persecuted physicians and other healthcare providers who were using it just because they wanted to push the vaccine. So you have to ask yourself why. And, it is true that if you have a treatment, you cannot have an EUA, right? So is that the reason? Most likely it is. But again, the question is why? Because essentially, if you look at the vaccines in general, and I'm not talking about COVID, but the idea of vaccination was to give someone a vaccine so that their body immune system responds to it. So if they encounter this disease in the future, the system will say, I recognize you, I know what to do, and you're not going to get really sick. So that's kind of the idea of the traditional vaccination. You don't vaccinate your way out of an epidemic. You don't put a vaccine in the population while the disease is wildly spreading, right? And then like they kept on saying, well, you have to get a booster. That was never a treatment. They kind of essentially treated this vaccine as a potential treatment, which never made sense. And the fact that they didn't let us do our jobs should have alarmed everyone.
Yeah, and Dr. Lindley, your understanding is correct. I believe that an experimental vaccine, emergency vaccine, is only permissible if there are no
No
if
treatment.
there are no treatments available that are effective. And you're saying that you not only knew about one, but you were actually applying one that was showing great results. And rather than respond in a way that was congratulatory and celebrating that fact, you were, and doctors like you were actually suppressed, and grand efforts were made to keep you from being able to even practice medicine. That is quite alarming to me. And I admire the fact that you went forward nonetheless and honored your Hippocratic oath and honored your duty as a doctor.
Yes. And Dr. Kat, I would also like to mention, you said that the treatments or the vaccines were considered are used as treatments. And I was working at Pfizer at the time, believe it or not. And I saw where the treatment, the only acceptable treatment probably still today by, according to CDC and the FDA, now known as Paxlovid, was initiated basically the same time as the vaccine inside of the company. But the vaccine was accelerated and Paxlovid was essentially, slow walked. And that may be because of the EUA. I'm not sure. But it's remarkable that the only acceptable treatment would be a novel treatment, not something that was known. I find that very
Yeah,
concerning.
and it's interesting they went with Paxlovid because we actually see a lot of rebound. I don't prescribe it. We see a lot of rebound, but not only that, it has a severe interactions with many common medications that our patients are on. And the fact that we are not using something that's very cheap and actually has great results should still be alarming, because there is plenty of literature out there to show that it works, and they had to retract that whole ivermectin mess that the FDA did. And it's true, like, I'm glad, those are my friends that actually went and sued them, which was Dr. Mary Talley Bowden, Paul Merrick, and I think it's Dr. Apter with them. But FDA was acting like a physician, right? And we are allowed to use off-label medications as long as we have good informed consent and explain to the patient why we are using something. So everything that physicians have done during this time was legal and medically actually kind of important, because and it wasn't that, people always get stuck on ivermectin and hydroxychloroquine. Those were not the only medicine we used. We used azithromycin because people end up developing secondary bacterial infection. We used steroids to decrease the inflammation. We used colchicine at one point because it also was helping with inflammation. We used antihistamines because there's this whole huge component of allergic components. So there were many medications that we used. And most importantly, we kept people out of the hospital for the most part. So that should have been celebrated by the NIH and CDC instead of, like I said, persecuting physicians who did that.
Yeah. And Dr. Kat, you've been following the moves of the WHO and these health-related international organizations very closely. Was there a specific moment or inciting event that kind of turned you on to that and said, I've got to track what these folks are doing?
So, like I said, I looked at it from two different sets of eyes. One of them was that globalism, because what I recognized is, I don't know if you remember Build Back Better. So Build Back Better was the logo that our president used, the President Macron used, Boris Johnson, the Australian Prime Minister, New Zealand Prime Minister, everyone used exactly same language. That never happens. We can have closest allies. UK is supposed to be our closest ally, and we may agree on certain things we want to do, but we never use exactly the same words. We all say whatever is essentially important for our country, and the messaging is kind of the same, but not the same words. So that was kind of the thing that it flagged to me that something is happening. And then the World Health Organization and several of the world leaders came with this idea, there is going to be a future pandemic. We need to start working together. And then they came up with the agreement, the treaty. So I really started tracking it very early on. I was part of World Council for Health at the time, and I do have to give them credit. That came on their radar. And as part of the council, that's kind of where I started looking at it. And then later on I left, but I continued my work with World Health Organization because they kept on changing the language. The important thing, at the same time, while they were talking about the treaty, they were also renegotiating or adjusting the amendments to international health regulations. So these are two different documents. The treaty goes one way, they agree on it, whatever, but it has to go to the World Health Assembly. They need 2/3 of the votes in the assembly. And then the treaty has to go to the country's parliaments, or Congress in our case, really Senate in our case, and then it needs to be ratified by the vote. As far as the United States is concerned, Senate needs 2/3 of the vote to ratify the treaty for the president to be able to adopt it. The important thing to note is that the Paris Agreement or Accord, whatever you want to call it, was a treaty. But President Obama said, well, there's just some changes in this, so this doesn't have to go to Senate. I'm just going to sign it. So there is a danger with this pandemic treaty that the President Biden is kind of going to try to do the same.
Yeah.
Bypass the Senate. And please go chime in, Chris.
No,
but that's
yeah,
really
that's a great
danger.
point. That's a great point, Dr. Lindley, and a number of people have been rather concerned about that. I can tell you probably 100% that if he does attempt to do that, based upon his assertion that it's only an agreement that's sort of amending protocols that were in place before, that's going to be challenged constitutionally. And I believe that the U.S. Supreme Court, in all likelihood, would declare that unconstitutional and would require 2/3 of the Senate to ratify any such agreement. I certainly hope that is the case. You know, there's a reason why our founding fathers made it 2/3 of the Senate to ratify a treaty. They thought it was that important. It wasn't just a majority to ratify a treaty that the president wants to enter into. It was 2/3. That's how important our founding fathers thought Senate approval and ratification was. It's not supposed to be an easy process. It's supposed to be a process that requires real deliberation and real constitutional scrutiny. So I'm so happy that our Constitution has that in it. And obviously, we're going to be looking at it very closely. And I'm glad you mentioned that ratification requirement in the Constitution. But I want to ask you also about, so we view the ratification provision in the Constitution as one protection of our country against what Biden is trying to do. And also, our own legislature here in Louisiana recently passed Senate Bill 133.
Chris, before you get into that, can I just ask you one question about this? Do you think that the Biden administration signing of this treaty, let's say they do go ahead and sign the treaty, do you think that this, I mean, the constitutional challenge I can appreciate, but there's got to be plenty of damage that can be done in the ensuing time between when the courts are able to address something like this and the time it gets instituted. What in the world could happen in that period of time?
Great question.
And I actually do share your concern, Danielle, there, because they changed the time from which the treaty would come into play. I believe, I would have to go back and look at one of the articles, but if they have certain amount of countries agree to it, it actually goes in effect sooner. So we do, there is a danger that if it's signed in May, this could kind of come into play pretty fast. And one important thing to note is, I spoke about One Health agenda a little bit earlier. Our states have One Health departments already. If you go to CDC website, they started talking about One Health in 2017. So CDC and HHS, for example, already have this One Health program and offices and departments. So in my opinion, I think it's a plug and play type of a thing. It gets passed, you pretty much plug and play into it. The only way, and I don't really think that our candidates understand the dangers. In a sense, well, we know where Biden stands, so I'm not even going to go there. But RFK Jr. and Donald Trump have independently kind of said, and I do feel they need to be stronger on this, especially I would love to hear President Trump actually make a statement just on this, but he has said it. They're both against the World Health Organization having any input, and I do appreciate that. I don't think they understand the level of bureaucracy that's already in place. So whoever goes into power, not only do they have to get us to exit WHO, stop funding them, write an executive order, I will not accept this. That's all good. But then he actually needs to dig inside his HHS department and look at the departments inside and then cut them out.
And
because they're there.
And Dr. Kat, what are some of the things that they may try and institute via this treaty?
Well, the treaty is actually really vague. And Tedros will say often that people are spreading lies. The treaty is not affecting our sovereignty. The treaty is not going to go under every country. The country is sovereign in its own. We are not dictating doctors what to do. So he's not actually wrong on that if you just looked at the treaty by itself. Because, the language is vague and there's a lot that they can do because they're creating this, what I call it. It's not confederation, but something of states, but everything is really vague. They don't really define anything. So that's why I say you have to look at the amendments to IHR, because amendments to IHR are actually specific. And you have to go to Article 18 specifically. Article 18 says, if there is an emergency somewhere in the world and WHO thinks it's important to them, the Director General, and this is important, Director General, one person, can declare public health emergency of international concerns. Once he does that, he can actually dictate certain things. Some of them are medical treatments, diagnostics, exams, vaccines if needed, therapeutics, but also border closure, quarantine, isolation. And then if you dig deeper in that Article 18 under paragraph B, C, whatever, there is something about trade as well, because you cannot have trade in a country that has its borders closed. So then you have to ask yourself, if you, and I am not a lawyer, I'm only a physician, and I love reading and learning. So if I just look at that statement by itself, I would say, well, first of all, if it attacks doctor-patient relationship, because it's telling the doctor you can only use this, right? So I cannot give patients any alternative treatment. And if I do, I can get in trouble. And there is Article 44 where it says that my country can censor me and take, appropriate actions against me. But then if you look at the border closure, the trade, the quarantine and isolation, but that's a national sovereignty, right? They're telling a country it has to close its borders. If you close your borders, you cannot have people coming in and out. That affects sovereignty. The trade affects sovereignty. And then you have multiple other articles that talk about intellectual property, the surveillance of pathogens in each country that has to be reported to WHO because they have to keep the data and everything. So, this is something where I love when constitutional lawyers talk about it because they truly understand the legalese of the language. But it's important to note that this is an attack on national sovereignty with everything else, quarantine, trade, everything. But at the core of it is WHO, who would be in charge of the global health.
That is the crux of it all. And the argument obviously is going to be that any agreement entered into by the executive, well, no matter what you call it, with international organizations or other countries, absolutely requires approval and ratification by the Congress. And this could well ultimately be decided by the U.S. Supreme Court. But Danielle, your question about what happens in the interim is such an important question. I know during COVID itself, there were constitutional challenges made to all of the overreach, and ultimately the citizens were vindicated on those challenges, but there was a lot of damage done during the pendency of those cases. So that's such a pertinent question that you ask. Well, speaking,
Chris, before we go into Louisiana bill and all that, it would be interesting actually if you guys brought in a constitutional lawyer or someone who's really good at this and asked them, why haven't we challenged pandemic accord?
Well, I am a constitutional lawyer.
There you go, Chris. Yes. So you tell me, why haven't we challenged it?
We haven't challenged it because so many of our leaders, unfortunately, are compromised to international organizations and the connection between the international organizations and big pharma and big medicine and even big business in our country. But that is a great, great question that you ask. This should be challenged. I know that some have challenged it, but you're right. There should be an outcry on the part of our leaders about any effort to bind this agreement on American citizens or on American states. I couldn't agree with you more. And there should be more, and hopefully will be more. And even President Trump should be, and RFK should be talking about the constitutional implications of this.
Chris, is this something that AG Liz Muriel and perhaps Ken Paxton next door in Texas could take on behalf of the people of the states?
I believe that it is, and I believe that Liz Muriel, our Attorney General, may well do that because it violates the Louisiana Constitution as well. Of course, she could challenge it on the basis of both the Louisiana and the U.S. Constitution. And so
maybe we should bring it to her attention.
We should.
Because my fear is that they will use that as a precedent, right? They're going to use the Paris Agreement as a precedent to say, well, we've done this way as well, and it's not an issue. And I agree with you, it will go to the courts, but during the time, like Danielle said, before it does and if Supreme Court decides to take it on, lots of damage can be done.
Lots of damage can be done. And it looks like one of our representatives here in Louisiana, Thomas Presley, very sagely has sort of foreseen the issue that y'all are talking about, the damage that can be done. So he brought some legislation right here in Louisiana, which has now passed the Senate, still has to go to the House and ultimately be signed by the governor. But as you both well know, this legislation essentially says that Louisiana will not implement or enforce or mandate any international health protocol from the WHO or from the, any international health organization, simply will not be enforced or implemented or recognized here in Louisiana. And we believe that that is a very, very good step in the right direction and really is an assertion of our own state sovereignty in the face of this international overreach.
I'm excited to share a fantastic opportunity for State of Freedom listeners who are interested in investing in precious metals or even starting a home-based business in the precious metals industry. Metal Stacks is a precious metals collectors club where you can buy your metals at the best prices on the market, actual dealer cost. They are beating the big sites. They have no credit card fees and no minimums. If you're just interested in purchasing metals at a great price, visit metalstacks.com/dwalker. Get to shopping, that helps me out. I get the commission. You can also refer people to Metal Stacks for an additional income. If you're interested in learning about the referral business aspect of Metal Stacks, email me directly at danielle@freedomstate.us for more information.
What are your thoughts, Dr. Lindley, on SB 133 right here in Louisiana?
So I'm a huge fan of Senator Presley. He came to our space last Wednesday, and he's all fired up on this. You can tell that it really matters to him. He really was great. And I know him and Representative Edmondson said that they'll both come back to speak. And we have these Twitter spaces every Wednesday at, I believe it's 6 p.m. Eastern. 6 p.m. Central. I'm Central, and the rest of the crew is Eastern, so I always get confused.
I'm always forgetting.
But it's a good space because that's what we're going to do. Every week we're going to talk about the World Health Organization. But I love the bill. Some people are saying that they are concerned about the UN part because it might affect the treaties that we have. And I said, so what? I'm actually glad that it does, because I would say that half of our UN treaties should probably be banned anyway. So I'm a huge fan, and I'm hoping that it will pass your House without much trouble, that our own state would look into it. Our problem is that we are not in legislature this year. We do every other year, but they can start writing this bill maybe in November. Someone can write it and then carry it on next legislative session.
Yeah. You're in Texas. You're in Texas, right?
I'm in Texas. Yeah. We do, it's kind of hard when you can't really do much right now. Everyone is still campaigning and things. It would be great. Louisiana would be the first state to actually do it. There are several states who are working on it, including New Hampshire, and I testified in New Hampshire for their bill. I think the biggest problem with the New Hampshire bill was they included, it was WHO and CDC. And I think Democrats kind of cringe on the CDC part because they still think that that's a relevant governmental agencies that is helping. I would say that CDC has lost a lot of their trust for sure.
No doubt.
Interestingly,
No doubt.
the director went on this campaign to return the trust to CDC, and I'm thinking to myself, it's not going to happen, because not only we don't trust what they're saying, but they just pushed the 9th booster, and she said that in fall we're going to have the 10th booster. So and I don't know how. This really gets me from the medical standpoint. In the past, we have had vaccines and medications that had issues, and we had a very good pharmacovigilance system. The swine flu vaccine was recalled. I believe it was, I was confused if it's a rotavirus or RSV, but one of the other vaccines in children was recalled because it was causing interception. We also had Vioxx. I don't know if you guys remember Vioxx. It was an anti-inflammatory drug, but it was causing cardiac events. So after 6,000 plus reports, they recalled it and took it off the market. So we've done a good pharmacovigilance reports in the past, and that's when we trusted CDC that they're doing their job. Now you have millions of reports of different symptoms, severe and mild, but also death. And we're doing nothing.
And we're doing nothing
Every
about
time,
it. And we're doing
nothing.
Yes, and Dr. Lindley, you're so right that the CDC has lost so much trust. I don't know of anybody who actually, reasonably follows current events, who has any confidence in the CDC or really in the Louisiana Department of Health, for that matter, which mirrors and follows all of the CDC recommendations. I wanted to talk a minute about the CDC being included in state legislation of this kind. The problem, and I've spoken with other constitutional lawyers about this, including the Speaker of the House, Mike Johnson, and the issue with including the CDC in very clear legislation that prohibits the implementation of those protocols in our state is that the CDC, unlike the WHO, actually has congressionally delegated regulatory authority in Louisiana. They are statutorily authorized to take certain actions to prevent the spread of disease, communicable diseases, both from other countries and in our state. And so you can't, at least now, until the Congress rolls back some of that power, it would be a violation of what we call the Supremacy Clause in the U.S. Constitution for the state to put in a statute here that the CDC has no enforcement authority here, or that the CDC, their protocols and regimens will not be carried out or recognized in Louisiana. I guarantee you that would be challenged constitutionally, and probably the challenge would be granted. So that's the danger of right now including the CDC in this legislation. And I think you said before the show that it is probably a good idea at this time to exclude the CDC.
Yes, 100% agree. It's a good idea, and thank you for clarifying that part, because that's not the part that I knew about and was really concerned. My concern was just like from the other aisle. I know in my own hearing with the New Hampshire, that was kind of a sticking point, because I would say that a lot of Democrats still believe in CDC and also are concerned with the money that the state may lose because of it. So I think the best thing is just to stick to these supranational agencies who should not have any influence on our global health. One thing I didn't mention is in Article 1 of the amendments, the WHO has taken the non-binding advice, crossed out the non-binding and just left the binding advice. So if you translate that means it's an obligation now. It's not a recommendation. I get having someone like, first of all, I think we should get rid of WHO and we shouldn't have it. But if we had it, right, I get someone recommending you should do this, you should do that, because we looked at what's happening and this is helping. That's not, they haven't done their job, but that's what they should have done. But the fact that they will be able to tell us what to do is concerning. And every state, red and blue, should be concerned with having a supranational agency telling other people what to do. One thing we haven't spoken about is WHO itself, the funding of WHO. Initially, it was funded by each country. They paid their members due, they did their work, whatever. It changed over time to these public-private partnership funding 80% of WHO. Public-private partnerships are Bill and Melinda Gates Foundation, Gavi Alliance, Wellcome Trust, and many others. And when they give you the money, they come with the strings attached because they say you need to use this money for this. So you have to look at, is WHO really doing the job it was set out to do, which is to look at what's happening in the world, recommending and giving advice based on their experience? No, their advice comes with the money attached. They have to, they have to do things. So if, in a scenario that Bill and Melinda Gates have this vaccine that they love and they need to make money off of it, they say, well, I'm going to give you billion, zillion, trillion dollars for this program, but you have to push it. So you have to ask yourself, are they doing what's best for us or what's best for their stakeholders?
And Dr.
Yes,
Kat, you know
yeah.
the Gavi Alliance and Wellcome Trust, of course you know this, are funded by Big Pharma. So is the Bill and Melinda
everything's Big
Gates
Pharma.
Foundation. It's all
I would
funded
challenge
by
to say
Big Pharma.
our politicians are funded
That's
by
right.
Big Pharma.
Yes.
That's another thing that needs to be looked at.
Absolutely.
Every politician is funded by Big Pharma.
It's called
most.
regulatory. Robert F. Kennedy calls it in his book regulatory capture. And it is very, very true when you look at all of the money that these public health agencies, whether national or international, get from the pharmaceutical industry and from people like Bill and Melinda Gates. It's difficult to imagine how they can really regulate and make recommendations and protocols that are in the best interest of our health when they are captured by and beholden to all of these groups and organizations. That's a great point that you make, and we do need to make sure that everybody's aware of how these organizations are being funded. But let me ask you. I want to get your opinion on something briefly, because the SB 133 here in Louisiana, obviously, it prohibits this state from recognizing any health protocol or recommendation from an international health organization that they've adopted. So what happens then? What are the implications of that if the Biden administration enters into an agreement that is based upon those very same international recommendations that we have now prohibited here in our state? I think there's a strong argument that can be made that we have passed legislation that prohibits our recognizing health recommendations and protocols from international organizations. And the mere fact that the Biden administration, our federal government, has joined in those recommendations in an agreement does not make them any less unenforceable in our state, because the UN, or the WHO, is still a party to that agreement. And to the extent that they are a party, and to the extent that these recommendations and protocols are really their recommendations and protocols, they are still unenforceable in the state of Louisiana, even if they are the result of an agreement with the Biden administration. That would be the way I would interpret the legislation. Indirectly, this legislation may well be prohibiting the enforcement of domestic CDC protocols because of their resulting from an agreement with an international organization.
So I would say that that's actually your court more than mine, because I would say that at this point you would have to have a constitutional challenge and your attorney general should sue the government. But I do feel that that is exactly what can happen. And, I go back to this Paris Accord. Even if our Senate gets the pandemic treaty, because the question is, will they even get it? Uh, but even if they get it and they don't ratify it, and you have a president who is in favor of it and his administration has negotiated most of it, he could do an executive order and still say, well, I like it and I want us to be a part of it. And then the question is, what do you do with the law that Louisiana has passed? I think it goes back to the funding rate, how much money the government is giving the state. But this is, again, 10th Amendment argument, where it says that the states are the ones that are in charge of the health of their citizens and not the federal government. But this is something that I think your attorney general and governor need to look into.
Very much
I have
so.
spoken with different departments here in Texas, Senate and stuff. Uh, our HHS, they get grants from the Texas HHS gets grants from the CDC to put certain programs into place. So it's a lot of money at play that state doesn't want to lose. And also, a lot of HHS appointments in the state are not state appointments. They are federal appointments. People come from federal HHS down to your state HHS and implement programs. I think there needs to be separation between state and the federal government, even within the departments.
Yeah.
And,
Too
I don't
much
know, you
overlap.
guys, yeah, I don't know if you guys.
Way too much overlap. You're right.
Exactly. And I don't know if you guys have like attorney general like Florida has. We don't have attorney general. We have like I know a governor has created some kind of office where we have like state epidemiologist who's in charge. But I think it's very important to look at those appointments on who is truly in charge of the health in the state, because it needs to be a physician, not a public health official who's never practiced medicine. And I would challenge that it needs to be a physician who has practiced medicine as well, because there is a difference between theorizing and actually clinical experience. Dr. Jay Bhattacharya and I are great friends. I love Jay. But we did a podcast a while ago, and him and I just had like a conversation, kind of like friends at coffee. It was like I said, I don't usually prepare for a podcast. We just talk. And we started talking about public health because he's a public health official, and obviously he strongly believes in it. He believes that we've done a lot of bad things and there are a lot of failures. He's totally understand what's happened. But I challenged him. I actually am not. I understand the need for public health, but I don't like it. I don't like public health. In a sense, when they make decisions, they make statistical judgments on something. Whatever is happening, what is best for everyone, right? They don't look at that person in front of you. They don't look at, let's say, Chris, you're my patient. I have to do what's best for Chris, not what's best for Danielle and her family. I need to take that in account, and it's in the back of my mind. But my decisions are based on Chris' health. In public health, it's opposite. You base these decisions on numbers. You don't have people's faces, names in front of you to understand the gravity of it.
And that's the exact difference between communism and individualism as well.
Yes, exactly. We haven't really touched on this, and I don't think we need to go there. But this whole transgender agenda going after our children specifically, I'm not talking about adults. I always say, do whatever you want to do and to be happy. You don't affect my life. I'm good with it. But when it comes to children, first of all, especially a little child, cannot make these type of decisions. Their hormones, the whole hormonal axis is still developing. There's a lot to be said that we need to let children be. But you cannot say that like all of a sudden they're changing and we need to give them drugs and surgeries at 6, 7, 8, 9, 10, 11, 12. That's like that age where you cannot influence it from with the outside aspect with hormones and things like that. But what's happening on the greater? So let's take that aside. If you look at it kind of from the outside, you have to understand we are trying to confuse the children. from whether it's a boy or a girl. So if you're a boy, now you're a girl, or you're something else, pin, whatever. Because by doing that, we're taking away their individuality. And we're creating units that are just it. They're not he or she, they're it. It is really easily controlled. And that's what totalitarianism does. You are a unit, you have a place, and this is where you stay. You don't leave this place. And that's an attack on that American dream,
It
right?
is an attack on the American dream. And I have to ask you, since you brought it up, even though that's not really the nucleus of what we're talking about today, but I want to ask you, how prevalent, how much of a threat is this movement toward this transgender mutilation type surgery, the puberty blockers, not just in the United States, but internationally? How much of a threat is that?
It's a huge threat, and this is where UN comes into place. There is a document on sexualization of young children, and then there is this huge push for transgender identities, rights, and things like that. Again, this has to do with global governance. One of the things that people need to start looking in is UN. People forget that WHO is really health arm of United Nations. And we are all stuck on the what's happening with WHO, and we should. But everything that's coming from WHO is coming from UN, and it has to do with global governance. So it's not only global health, it's global governance. United Nations essentially wants to be in charge of the world. And this is, it's probably a conversation we can have for another time, but you have to look at the European Union and what they have done, because they are a microcosm of this big idea of global governance. So all of this transgender ideology is actually something that we need to concentrate on more. We keep it in the back of the conversation. We haven't truly gone after it as strongly as we have to, because this has to do with what I'm talking about. In communism, in fascism, in totalitarianism, there is no individual. There is units that do what they're supposed to do. Talk about AI. This whole introduction of AI at the same time we have transgenderism. You have the COVID that has taken a lot of our rights away. People are looking at things in a box. They need to start opening their eyes and connecting all these boxes. They're all connected and they all have the same purpose. And the same purpose is for us to stop being Chris, Danielle, and Kat. I'm one unit, you're unit number 2, you're unit number 3, and you do what the government or whoever is in charge is told to do. That's where we're headed. That's that global picture that people are not looking
Yeah.
at.
And Dr. Kat, on that topic, you raised about some of the insidious things they're trying to do with regards to health, whether it's transgenderism, whether it's untested vaccines or health protocols. Even the diagnostics we found are very, very sinister. And then the state sovereignty issue as well versus the one world government. What legislation have you seen from your bird's eye perspective of looking at both of these issues and kind of looking at them also from one lens? What legislation have you seen across the states or maybe in other parts of the world that are protecting people from both of these two arms of kind of evil that's trying to control us?
So Dr. Meryl Nass has doortofreedom.org website, and you can go there. There's like a legislative tab. You can see specific legislation that has to do with WHO and some United Nations. I think I was talking to Danielle Horowitz last week. I think Thursday we did a podcast. And I really think that what needs to happen is, so Chris, this is your subject, not mine. Plus, I'm a naturalized citizen, so I'm still learning things. But this country was created as representative republic. What we need states to do is to actually remind the federal government who's in charge. States are in charge, not the federal government. Sure, there are some things that are under federal government domain, but we need to actually kind of re-exert that notion. We joke about Texit all the time, But I'm in favor of Texas at this point. Texas leaving the union, because the union is corrupt and it's making decisions that we don't agree with. And when are we going to say, stop it? We had enough. We haven't done it. You guys have now a great governor. I believe he was your attorney general, right? And as attorney general, he did an amazing job. We need more leaders like him. We need more DeSantis. We need more Joe Ladapo. We need attorney generals who truly understand state rights first.
Yes, and we believe we do, and we believe we do have one who does understand that. And I'll tell you, Dr. Cat, the whole purpose of the foundation of Louisiana Citizen Advocacy Group, which is our organization here, and also the State of Freedom, which includes the podcast that we're on now. The whole foundation, philosophical foundation of those two organizations is the fundamental notion that states have plenary authority over the activities that regulate their own health, their own welfare, and their own lives. And unless constitutional authority is specifically delegated to the federal government, which are limited and enumerated in the Constitution, then those rights and that authority defaults to the state governments and the state legislatures. And you are so right that is something that has to be emphasized more and more and more throughout the country. The state legislatures and the state governments have plenary authority under both the 9th and 10th Amendments of the Constitution to both reject federal or international acts that are unconstitutional, and also to implement their own protocols that are in the best interest of their own citizens. So it's a great reminder from you to make sure that we continue to beat the drum on that issue of state sovereignty.
Can you imagine if we actually were paying taxes to the state? And I know some states we do pay taxes to, but I'm just saying, instead of doing federal taxes, if you actually pay taxes to the state, and then state paid their portion to the federal government. Can you imagine what would happen? I think they would find themselves a little bit more confined in the powers that they seem to think they have.
That's right. Instead of getting $700 million a year, the state of Louisiana gets $700 million a year from the CDC and like organizations in the federal government. And as Thomas Presley pointed out, Dr. Cat, until we begin to divest ourselves from that federal money, we are going to be compromised in the way we respond to these outbreaks and to these protocols.
Yeah, absolutely.
For sure.
And Dr. Cat, you have your hands in a lot of pies right now. Would you tell the listeners what is the best way to follow your work, support your work, get involved in your work?
Probably Twitter. For those of you who like Twitter, my handle is KLVeritas, VERITAS. I usually post most of the things there. And I'm involved with Sovereignty Coalition with, Dr. Kathy Willis, Frank Gaffney, Reggie Littlejohn. We are doing webinars Monday, and you can go on sovereigntycoalition.org and sign up for those. I think those are going to be good because every Monday we're going to try to do an update on the World Health Organization until the vote in end of May. And then we're doing Twitter Spaces on Wednesday, I believe it's 6 Central. And you can join. Usually we'll have conversation probably for 20-30 minutes and then bring speakers up to ask questions. The other thing is on sovereigntycoalition.org, you can sign the Align Acts that will go directly to your federal representatives and state representatives. I think it's very important for the ones who are not in Louisiana to look at the SB 133 and then submit it to their representative in the state and try to find champions in the House and the Senate to see who would be carrying this on. And then, for Texas, we are not in legislative session, but this should be sent to our Attorney General, and we do have a great Attorney General. I think he's been great on suing Pfizer, and he did have a lawsuit with Oklahoma that kind of went silent, but we need to bring more of these lawsuits forward and make sure that the federal government understands that we don't want World Health Organization or United Nations to tell us what to do. I understand the need of collaboration, and I'm fine with people giving recommendations that you can kind of take in, decide whether you like them or not. But the idea that anyone would mandate to another country what to do, I think it's attack on sovereignty. There's nothing bigger than that.
No question about it. And the idea, Dr. Lindley, if you had told me 30, 40, 50 years ago, 80 years ago, that there would be any controversy in the United States about whether or not an international organization can bind sovereign Louisiana citizens or sovereign citizens of the United States or the United States government itself with regard to protocols that they conceptualize, that they envision, that they implement, I would say there's no possible way. That's not even a controversy. So the fact that we're even having to have a discussion about whether or not they can unilaterally bind free states to these international decrees and protocols is an alarming statement about where we are in our culture and really in the history of a free republic.
I'm glad states are waking up, right? And they are. But it's alarming that our federal representatives are not. Every time you have a conversation with them, they say Constitution will protect us. And like I said, I am not a lawyer, and I can tell you it will not. It will protect us only if we follow it and actually read it and act on it.
It's not going to get up and fight for you.
Exactly. It doesn't have arms and legs. It's only as good as the people who are defending it.
Exactly. And, so that's why I am disappointed at their ignorance. And you have to ask yourself, is it willful ignorance or they just don't understand? And I would say at this point, I'm really leaning more towards willful ignorance because if you have doctors who are not experts in this sounding the alarm and you're doing nothing about it, you have to ask yourself, are you really doing it on purpose? And do you have reasons not to? And I would say many of them probably have reasons not to really look into it because they're happy with the state, with the idea that federal government has this much power over us. And I hope that people take elections seriously and truly look at where do we want to go, because the train we're headed on is off the tracks almost all the way.
It is.
And we're not going to be able to come back from this.
No, we have one last chance here, I believe, before it is irreversibly changed. And that's why it's so important that people like you are out there sounding the alarm and doing it in such an articulate and well-informed way. It is, as I said at the outset, it's really a privilege and a pleasure to have someone like you on our show. It gives us hope to know that you and others like you are out there fighting and raising the flag on all of these issues. And so just a pleasure and an honor to have you with us.
Thanks for having me.
Thank you so much for coming on, Dr. Kat. Hopefully we'll get you back soon.
Have a great day.
Thank you. Bye.
Chris, Dr. Lindley is a warrior. I mean, I said it from the beginning that she's a warrior for truth, but she sees things very clearly. And I think her time spent under the thumb of communism in the former Yugoslavia was very informative to her, informed her perspective and helped her see things that maybe we're a little slower coming to as children who were born in freedom. It's just amazing how slow we've been to see that basically we're that frog boiling in the pot and we're almost cooked.
And we're almost cooked. And it's amazing. Many of the people who are sounding the alarm are people who have immigrated to the United States and have come from totalitarian countries. I'm reminded of a book that I read not too long ago by Rod Dreher. And the title of the book is Live Not by Lies. And in that book, he talks about several people who have come from a communist or fascist regimes to the United States. And they are warning very emphatically and as broadly as they can about what they say see is happening in our own government. And it echoes, sadly, many of the things that brought about tyranny in their own country. But it's interesting. She also talked, Danielle, about what I call the soft tyranny of modern totalitarianism, which is they know that they can't go out in the street and do this through use of military force because that would be obvious to even the obtuse. So what they're doing it is through the slow but sure habitual and psychological manipulation of our minds, our hearts, our culture, pouring things into our culture that are designed to deaden us, that are designed to distract us, and really to render us to a state of almost helpless apathy. But they're doing it in a way that is much more subtle and much more sinister. Yeah. And we have to be on the lookout for that.
Yeah. And, even Dr. Katz's reaction to the scripture reading, I thought was very telling. She talked about how the premise of the World Health Organization is a direct affront to the Word of God in Genesis about his order of creation. And I just think it comes back around, and it's been coming around full circle for me pretty strongly the last 2 weeks, that we are in a spiritual battle. This is a spiritual war. We can talk about there being all of these different, aspects or fronts of the war, but all in all, the whole entire war is a spiritual war. And I don't think anyone could convince me differently at this point.
No, it is a spiritual war, and we're not battling against flesh and blood, which is why I heard recently, and maybe it was from you, that we have to remember that the physical manifestation of this battle, the people who are aligned on the other side of it, are not really our ultimate opposition. They're not really our ultimate opponents. The ultimate opponents is the spirit that motivate and control them, to which they have been given captive. So that's why we have to fight this on a spiritual level, because ultimately we cannot win this in our own strength, but we can certainly win it if we surrender to the sovereignty of God and remain faithful to Him. And I believe that we will win it on that front if we do. But you are so correct in your assertion that at bottom we are fighting against the spiritual dominion, the spiritual reign of princes and principalities that we can't really see in the flesh.
Yeah. And I hate it, but it's true. And here we are, and we have been given, as the scripture tells us, every weapon we need to conquer this. So we need to stand up. We need to put on the full armor of God every single day to protect ourselves, protect our families. And we need to speak the truth, because there's power in the word. God created the whole entire universe with a word. So, and if we're made in His image, our words have power. So let us remember that indeed. Our words have power. That's part of the reason for this show, because we believe our words have power, that truth resonates in the hearts of believers. And that's what we're counting on.
And we are His hands and feet on earth. We have to remember that. We are His hands and feet on earth. And what we do here resonates in eternity. And we want to make sure the things we are doing will resonate not only for the well-being of our fellow Louisiana citizens, but resonate in eternity, where God can look at us when it's all done and say, "Well done, my good and faithful servant." So that's the reason why we need the support of all of our listeners. That's why we need steady financial support, so that we have the resources to stand up against this national and international tyranny that is not stopping. It is not stopping. Okay, we can do all that we can do, but we have to be prepared on every front to battle against it and defeat it. And that's where your financial support to LACAG and the State of Freedom come in so handy and are so urgently needed. We will fight hard. There are no better fighters than we are. There are no more courageous warriors than we are. But we need a loaded gun when we go in there. And the Holy Spirit in our hearts, armed with His power, and also the people we're opposed to, knowing that we have the power and we have the resources to expose them if they betray you. And that's where your financial contribution comes through. And we are so excited about all of your support and the increasing trust that we are gaining with you.
Yes, and just a reminder that if you would like to give to the State of Freedom, you can do that at freedomstate.us. You can give to LACAG at lacag.org. You can become a member there. The P.O. boxes are both listed on the website, but the one for the State of Freedom is P.O. Box 861, Berg, Louisiana, 70343. And Chris will be dutifully telling you the P.O. Box number for LACAG.
LACAG, P.O. Box 64952. That's LACAG, P.O. Box 64952, Baton Rouge, Louisiana, 70896. I can assure you, you will sleep well at night if you are one of the many citizens across Louisiana who are paying a small membership fee every month to be a member of LACAG to help us move forward and to reclaim our state. And ultimately, what we're doing will resonate nationally because we will be a model for the country. And if we do that, Danielle, and if we continue forward each day with pure hearts, good motives, and indomitable courage that comes to us by the grace of God, we will take grand steps each day to preserve the state of freedom, not only in Louisiana, but in America.
Amen. Thanks, Chris. God bless you.
Thank you. God bless you.
Thanks for listening to The State of Freedom. To stay on top of all the calls to action we mentioned today, just check out the show notes for the episode. If you'd like to support the show financially, visit our website at freedomstate.us. If you'd prefer to give by mail, you can send a check to the State of Freedom, LLC, at P.O. Box 861, Berg, Louisiana, 70343. If you own a business in Louisiana and are interested in supporting our show by advertising, please email us at info@freedomstate.us. To get involved with Louisiana Citizen Advocacy Group, visit lacag.org, LACAG.org, or email Chris at chris@lacag.org. If you're enjoying the podcast, please subscribe and share it. Give us a 5-star rating in the reviews. Thanks again, everybody. We'll see you next time.